Hello, greetings from Aster Hospitals, Bangalore. I am Dr. Ravi Gopal Varma, Director, Global Center of Excellence in Neurosciences and Lead Consultant Neurosurgeon. I'm here to talk about brain tumor surgeries. Now I would talk on how to deal with it. Imagine you get to know that you have a brain tumor. It's a sudden shock, and it is something that it's not easy to digest because you would never have imagined to have a brain tumor. The brain tumor, when you say, it does not mean only cancer. It can be a benign tumor, it can be a tumor due to an infection, it can be tumor due to collection of benign cells. Benign cells are non-cancerous cells. It also can be a cancerous tumor. So the first time somebody hears, everyone says it's cancer, brain tumor is cancer. It's not true. There are tumors, brain tumors called meningiomas, brain tumors called schwannomas. These tumors, once removed, can permanently cure, and the tumors can never need to come back. You don't need to have a deficit. People say that if you have brain tumors, you'll be having one side weakness, you'll be a vegetable, you'll have this. So there's a lot of misconceptions about brain tumors. Having said this, we have to give importance to brain tumors. If a tumor is found, it has to be taken out for two reasons. One, by its presence in the brain, it can compress areas of the brain and produce problems. Number two, it can cause multiple symptoms that can lead to permanent disability. And number three, we need to know what exactly it is so that we can give further treatment for that. So first most important thing is, if you have brain tumor, meet a neurosurgeon, discuss with a neurosurgeon and remove the brain tumor. Now, you need to be selective where to go to remove a brain tumor. Brain tumors need a lot of expertise, need a lot of technical nuances. For example, a hospital which has navigation system, a fluorescent dye system, or an excellent microscope, beautiful micro instruments. It's such a hospital that you need to go into to remove a brain tumor safely. And that is why in our center we have all the latest technology. You can go all over the world. There won't be a single technology that is not there elsewhere in the world that is not there with us. So therefore it's very important, and not just us, but there are a couple of hospitals who are like that. We need to go to a hospital that can deal with brain tumors and deal with brain tumors with other systems. So when you operate a brain tumor, your heart should be perfectly okay. So you should have a very good cardiology unit, you should have a very good general physician unit, you have to have a very good anesthesia unit. So it's very, very important to select where you're going to get your treatment done. Treatment is simple. You have to just remove the tumor from the part of the brain without affecting the brain permanently, without causing deficits. A patient, once you operate, should become better off than worse off once you remove a brain tumor. And it's very, very important to decide where to operate a brain tumor, which center to operate a brain tumor. Do your research. Please look into the best places that can deal with brain tumors and removal of brain tumors. Once you damage the brain, it's a permanent damage. A liver you can cut, a kidney you can cut with a knife. Nothing's going to happen because they regenerate, they become better, but the brain does not. So you should be very, very sure that you're going to a center that does perfect brain surgery so that there is no permanent deficit that can be caused. Thank you.
I'm Dr. Nirmala, Consultant Neurosurgeon, Aster CMI Hospital, Bangalore. I'll be talking today on brain tumor awareness, and I'll be talking about what is brain tumor, what are the different types of brain tumors that can be there, and what are the symptoms with which the patients will come to us, and when we should actually investigate on these patients. Brain tumor is abnormal cells or abnormal growth of cells that are there, which can be on the coverage of the brain or inside the brain or inside the ventricles, that is the CSF filled space in the brain. These tumors can be benign or it can be cancerous. Most of the tumors which arise in the covering of the brain most of the times are benign, and they are known as meningiomas. and the ones which can grow inside the brain, they have different grades. They can be graded from grade 1 to grade 4, and grade 1 they are usually classified as low grade tumors, whereas as the grades go higher up, they are known as high grade tumors. And as the grades go up, the treatment plan also changes according to that. Now, even when we classify these brain tumors, they can be those which are supratentorial, that is above the tent, or it can be infratentorial, that is it can be in the posterior fossa. Most of the times these tumors, when they arise in children, they are commonly seen in the posterior fossa, that is in the smaller brain, that is where we call it as cerebellum, and the midbrain, pons. These are the areas where most of the times in children these tumors occur, whereas supratentorial tumors are more common in adults. Now, how do these actually common symptoms with which the patients can come to us is headache. Now, all headaches need not be classified into tumorous headaches. The headaches which are severe, continuous, does not relieve with analgesics, sometimes gets relieved when there is vomiting, and there can be other symptoms like blurring of vision, there can be weakness, there can be seizures, there can be loss of consciousness, and sometimes patients come with difficulty in walking, there will be a change in their gait, or there can be some hand movements, like they can have some tremor in the hand, and these symptoms can cause, these are commonly seen symptoms in brain tumors. Though these tumors are easily treatable, there are various ways in which we can investigate these brain tumors. Most importantly is the MRI. When we take an MRI, it shows us clearly as to what is the location where the tumor is present, whether it is inside the brain, on the coverings of the brain, or outside the brain. And even in the MRI, many times we can differentiate to some extent whether they are cancerous or whether they are non-cancerous by doing a spectroscopy. There can be other investigations to look at whether the pressure in the brain because of the tumor is high, like we can get an ophthalmological examination for papilledema. Thank you.